So today I've decided to talk about this. Do you know there are occupations in Australia's skilled occupation list and they are still in the priority list? And most especially, these occupations, group of occupations, are very easy to get, and some of you already have it. And the interesting part is that most states and territories still have them under their priority list for visa nomination. Okay, so the question is this: why are you not going for this occupation? Why are you not going for them? Or because you're not aware of them? People that have come via consultation will know that I've mentioned these occupations and I've motivated them. If they are qualified, why not go for it? I said to you, forget about aged care, forget about caregiver, forget about healthcare assistant, for goodness sake. Most of you are qualified for these occupations. You need to start going for them. They are scarce skill in Australia. Australia want them, okay? And they are not sophisticated. They are not very hard to get. Okay, so which occupation are we talking about? Have you heard about disability service officer? Yes, disability. Have you heard of family support worker? Family support worker. What of residential care officer? You know, they are somehow related to healthcare assistant, but they are somewhat higher in level. And most of you have already gotten first qualification, your initial qualification in courses that will qualify you to be this. Okay? Have you heard about welfare worker, community worker, and so on? Community worker, yes. I know most of you are qualified for this occupation, but you are not aware of it. Their assessing authority is ACWA, Australia Community Workers Association. I am telling you, okay, things will get better. With these occupations, you are ready to go. Now ask yourself, why do most Australia states and territories still have them in their priority list of nomination? Because they need them. You don't need a prophet to tell you that, because they need them. If they put nurses there, they put these people there. Youth workers, disability service officer, welfare officers, community workers, they are all there. You know, initially when Western Australia released their nomination list and priority occupation list, when I saw it there, I went to I think it was South Australia or Victoria as well. I saw them there and I checked the priority occupation list for the whole of Australia. Do you know what? They are in shortage in all Australia states and territories. Why are you not going for them? Okay, in this video today, I am going to show you how you will go for them, the qualification that you need and the experience you need, and most especially the visas you are qualified for. And who needs you? Australia needs you. All right, if this sounds like something you want to know, please sit back and let's begin. Hi everyone, welcome to my channel, Jane Kenny's Creation, where we keep it real. I am Jane and I live in Australia. Welcome. All right, so why am I talking about this today? Is because I see many people qualify for this occupation and they are not going for it. And this qualification, these occupations will give them visa faster than healthcare assistants and stuff they are going for, because healthcare assistant in Australia limit you to only one visa, which is what? Visa 482, which is employer sponsored. So you must get a job before you come. Whereas with these ones, you are qualified for a lot of visas, independent visa 491, 190, and even some have 189, which is also permanent resident. 190 is permanent resident. 491 is temporary resident, but you don't need anybody's job to grab them. You see? However, you can still go for employer sponsored if you find a job, but you need to know about this. All right, so you know how we do this. Let's go. The 4 occupations we're talking about today are welfare center manager, welfare worker, community workers, disability service officer, family support worker, residential care officer, and youth worker. Okay, all right, let's take them one by one. Number 1 is disability service officer. A disability service officer is a professional who works with people living with disability in a variety of settings, including clients' homes, adult service unit, group housing and disability service agencies. Okay, I want to quickly talk about the qualifications you need for this. Okay, relevant qualification, a relevant diploma or higher with a specialization in disability service, a community work Australia accredited diploma or higher with specialization in disability service, or the one you got abroad. Okay, and also you can have a relevant qualification with non-specialization, a relevant qualification that is up to a higher diploma. Okay, if you study something like sociology, social, political, economic structure and function, social policy, human development, function, including psychological, physical, social aspect, general specialization, welfare services, and so on. Where are those people that study sociology, political, economic, and whatever? All of them, drug and alcohol, whatever, boboti, they are inclusive. All right, let's move to another occupation. Family support worker. A family support worker conducts needs assessment and provide practical and emotional support to families experiencing short or long-term difficulties, neglect, or abuse. A family support worker is typically employed in such work setting as child protection, foster care, and family service organization. Okay, let's talk about the qualification. What do you need? A relevant diploma or higher with specialization in family service or children and family, a community work Australia accredited diploma, a relevant qualification that is non-specialized, like in sociology, social, political. So you see, it's the same thing with the other one. Okay, social, blah blah blah. I will drop a link that you need to go through and get to know more about this. Okay, let's move to another one. Residential care officer. Residential care officer is a professional who provides support for children and people with disability living in a group housing or government care institution. A residential care officer assesses clients' needs and assists them to plan for and assess education and training programs and any additional health, welfare, or support. Okay, let's go to the qualification they need. It's still the same thing. It's diploma. Okay, diploma with specialization or without specialization. They talk about courses that measures in sociology, social, political, economic structure, function, social policy, human development, and so on. Okay, it's still the same thing. That's why they are being assessed by one organization. They are interrelated. Okay, the next occupation is youth worker. A youth worker is a professional who plans, organizes, and oversees programs for young people. Youth workers work directly with children and young people, supporting them to build skills, develop positive social interaction, and make decisions that are right for them. What do they need? What is the qualification? They need a relevant diploma or higher with specialization in youth work, a community work Australia accredited diploma, a recognized relevant qualification in youth work that is higher diploma, okay, NQF level 5, or a relevant qualification with no specialization, like in sociology, social, political, economic structure and function, social policy, human development, function, including psychological, physical, and social aspect. Yeah, anything focusing on that. There are a lot of them. They are still the same thing with others. Communication, basic counseling, interpersonal. There are so many things there. Okay, all right. The next one is community worker. A community worker is a person who is qualified and experienced in working with individuals, families, and communities to address barriers which prevent them from accessing basic human needs, such as housing, health service, employment, education, and recreation. All right. What do they need as qualification? A community work Australia accredited qualification, diploma or higher, a recognized relevant qualification. All right, so qualification, diploma, bachelor degree specialization, or that covers sociology, social, political, economic structure, and so on. Okay, welfare, families, social policy, human development, and so on. Okay, remember, I'll drop a link. All right. Let's move to the next one. Welfare worker. A welfare worker is a person who is qualified and experienced in working with individual, families, and group to ensure they have access to needs, services, and are supported to achieve and maintain social inclusion. Guys, they are all related. The qualification you need, if it's in Australia, a community worker accredited qualification diploma is okay. From outside, you need to have a degree, okay? And it could be specialized, it could not be specialized, it could be from all those courses like sociology, social, political, and so on, okay? All right, let's move to the last one, welfare center manager. Welfare center manager is a higher position. I'm sure you know managerial position is higher position. This one, what do they do? Okay, they've listed what they do. They are managers, they manage, okay? And the qualification they need for this one is a bachelor degree, okay? They need a bachelor degree or higher, okay? Even people that did masters in health service management, degree in community development, community mental health, all those things, public health, masters of public health specialists come here, okay? Oh my gosh, people that study public health, they keep saying, I don't know what to do, blah, blah, blah. Here, this is your job, okay? Masters of Science in Management, Business Administration, Diploma in Development Studies, Public Health, Sociology, Community Development, all of them, they are under here, okay? Manager, okay? All right. Now you know you can go for these courses. Youth Service Officer, Residential Care Worker, Community Workers, and so on. You know how to go about it. Why not try? All right, that brings us to the end of this video. Thank you for watching out, and I will see you again in my next video. Remember to share, like, and comment. Bye.